Alexa, stop the Christmas carols. Ho, ho, ho. And we're back. Dad. Alexa, stop the music. Good evening. Hello, Bridget. Hey, Jen. Welcome back to Farty Facts, the Christmas edition, pre-Christmas edition. How to get ready for the holiday season and what you need to look out for. Hello, Neil. Hello, Emma. We're just going to wait for a few more people to join because it's actually been 9 weeks since we've done a live show and 9 weeks since you have had an update on any of my facts about coronavirus or facts about anything really. So I know there must be some things you're dying to ask me, so this is the place to do it. Right down here in the comments. I will see all of them. Thank you, Bridget. It's good to be back. Nice tree. I know, it's beautiful. And we have our Christmas coronavirus here. Thank you, Brendan, for making me this 3D coronavirus. So he's here with us, and I'm going to update you on a few things tonight. Oh, Karen, I've missed your comments. Thank you for being here. Okay, tonight we are going to talk about, one, the UK mutation that has been in the media the last 2 days. I'm going to give you an update on the Pfizer vaccine and what that means to Australia and our vaccines that will be rolled out. I'm going to briefly mention the CSL UQ vaccine and why that got stopped. And then I'm going to talk to you about the COVID-19 vaccine that I've had in a phase 2 trial. So I'm going to jump into it. Actually, I'll see if there's a few little questions here. I've got my computer on the side so I can try and see if there's questions. Maybe Emma, you can show me if there's any questions. Oh no, here we go. We've got some comments. Oh, great. I've got the questions up on the side, so please feel free to ask any questions and I will get to them as we go through the night. Okay, so today in the media, every news station was talking about the UK mutated strain of the coronavirus and how it was moving really fast through the south of England. Everybody just needs to hold their horses because that was a statement made in the House of Commons, okay, by someone who did not back any of their comments with any factual information from the genetic labs. So there may or may not be a variant strain going through the south of England. We just don't know yet. More than likely, yes, strains that mutate pop up all the time. Sometimes these strains, which are just really an error in the replication of the virus, can improve the virus, or sometimes they can be deleterious to the virus, so they can make the virus better or worse. And we've discussed many times on the show that just because there's a mutation doesn't really mean anything. It might not change anything to do with the virus. Now, what they're saying about this particular mutation without any evidence is that it is making the virus spread fast through the south, okay? They're not saying that it's any more dangerous, they're not saying that it's any more virulent, or they're not saying that it will have any escape mutants to the current vaccine that's being rolled out in the UK. Now, why would a politician say that there is a mutated strain of the virus sweeping through the south of England when a virus has just been rolled out in England? Would be to increase the uptake of of the vaccine that started to roll out on Monday. So until we have specific evidence from the geneticists, and the geneticists right now are saying they don't have any evidence that there's any mutated strain, let's just kind of put it into one of those political baskets right now that the government in England need 70% of the population to have the vaccine for herd immunity to protect UK citizens. So if a statement comes out without evidence saying that there's this mutated strain that's spreading fast through the south, that may increase uptake. So watch this space. There's nothing to be concerned about. I've looked on Next Strain, which is the data source that I go into to have a look at the way that the virus is mutating, there is no data about any mutation in the south of England. So let's keep a look at it the next couple of days and I'll give you an update. But so far today, the database where they put the entries in, where the reports come out of, there's no information. So without any data, take these statements in Parliament, with a grain of salt until the scientists come out and say otherwise. Okay. Oh, okay, that went faster than I thought. Any questions on that? I'll just have a quick look over this side, because I know that it's kind of a scare tactic, and a scare tactic that might make people go out and get the vaccine, which is not necessarily like the right thing by the government to do, but it's a tactic. Okay, comments here. Okay, Andrea said, okay, so we've got a few here. Andrea says, is it possible to stack vaccines? Like if we have one ready in the next 6 months, oops, moving so fast, but in a year or two are better. Oh, hang on, I can't see. I gotta open this thing again. Okay, hang on. How do I see these comments, Em? Oh, you're gonna take phone. Okay, Andrea says, is it possible to stack vaccines? Like if we have one ready in the next 6 months, but one in a year or two that are better and more effective vaccine is available, are we able to get vaccinated twice? Yes, you can. That is something that is possible, but it will depend. You'll need to wait for the guidelines around that. But yes, you can stack vaccines. Okay, yeah, good to hear you again, Sarah. Oh, hello, Fern. Merry Christmas vibes. Okay, Emma says, what percentage of the population will need to be vaccinated for it to be effective? Okay, so for the particular vaccine that was developed by Pfizer and BioNTech, they're suggesting that will be a 70% vaccine kind of rate across the population to develop the herd immunity. Tracy Foster, you're live. Oh, I'm back. Yes. Cass Dixon, good to see you back. Hope you're doing well. I have. Thank you, Cass. And I had a limoncello last night and thought about you, Cass, because that's what I bought with the little present gift that you sent me. So thank you. Okay, so we're going to move on from UK mutation vaccine. Basically, watch this space, nothing to be concerned about. Okay, we're going to move on to the next agenda item, which is the Pfizer vaccine. Okay, so the Pfizer vaccine is the one that was in collaboration with the University of Queensland by the Paul Young Group. Now, that particular vaccine was an mRNA virus vaccine, okay? So it had the genetic material for the coronavirus antigens, and in that particular virus, they also had a tiny little part of an antigen, so part of the shape of the HIV protein. And what they did was that they put those two little shapes together in the vaccine to help the coronavirus vaccine be effective. What happened, and this was a phase 1 trial, what happened was that it was very, very successful at developing a response to coronavirus, so the SARS-CoV-2, but at the same time, that little portion of the HIV that they put in there, which was not infectious, it was just a little picture of it, it was so potent that you also got a response to the HIV. So on testing, they were able to pick up responses to the coronavirus and a response to the HIV. And what that means is if we're getting a response to HIV, it's actually a false positive response. And when people get HIV screened down the track, they were testing positive to HIV, screening tests, even though they weren't HIV positive. So the phase 1 of that particular trial had to be, it's going to continue on to look at the longevity of the antibody response to the coronavirus, but it won't progress into phase 2 and phase 3 trials, which would mean that it will be rolled out to the wider public. So the Pfizer UQ vaccine trial has stopped altogether, except for the people that were in the phase 1 part of it. Those people there will still continue on, even though they've had that secondary response to the HIV, but that was something that they were aware of that might occur. Now, UQ and Pfizer do not have the time to go back and re-engineer or remake the viral structure remake the vaccine structure to reduce the HIV antibodies being made, because that sets them back 12 months, so it's just going to stop. Okay, I'll just have a look at my notes and see if I missed anything about that, and see if you've got any little questions here. Okay, molecular clamp. Yep, so the HIV protein acted as a molecular clamp to hold on to the little coronavirus. Interferes with the HIV screening tests down the track. But we've all known all along that there is no guarantees in vaccine production, and you know, as it's being played out across the world, things happen in the testing phase, and that's why we have testing phase. Did we all bring a wine? I hope so. Bridget, hey Sarah, good to see you back. Hope you're well. I'm well, thank you. Well enough. Nice tree. I've missed these lives. Oh, hey Karen. Hello. Okay. Julie, nice to see you, Sarah. Good to see you too, Julie. Okay. Julie says, was there a change in mutation as stated by SHO during their outbreak? I don't know. I haven't looked into that. As you all know, I've had a little bit of a break. I think we all needed to have a little bit of a break, step back from being totally submerged in coronavirus and really try and live as normal life as possible. So I don't know about that, Julie. Okay. Okay, we have Bruce. I just want to know if you will feel the microchip floating around under after we have the vaccine. Absolutely, Bruce. Bruce, are you going in the cruise for cancer? Please let me know. Bruce is a friend of mine who I met doing the mystery box rallies, which was a fundraiser for Cancer Council. So tell me, Bruce, are you going in the cruise for cancer? But yes, you totally feel where the microchip is. And so you're aware that it's there, obviously. Okay, Nicole says, with new cases being diagnosed in hotel quarantine, who's in charge of that now? The AFP? No, sorry, yeah, the AFP, the Australian Federal Police, are now in charge of hotel quarantine. What was that?
Victoria Police?
Sorry, Victoria Police, not the AFP, who were the next level up. State Police are now in charge of...
Lisa Neville, I believe.
Lisa Neville?
The Police Minister.
Police Minister, Lisa Neville. Okay, what is the name of the vaccine you are participating in? We'll get to it, Tracy. Ellen says, hello, yeah, you're back. Great to see you too, Geraldine. Okay, so we've moved on for the CSL. Now we can talk about my jab. All right, so I posted on Facebook a little while ago. I think it was 3 weeks ago that I was finally had been given the tick of approval as a healthy adult to participate in a phase 2 clinical trial for a COVID-19 vaccine. So now we've just talked about phase 1 being the Pfizer UQ vaccine, CSL UQ vaccine, which has been scrapped. That was phase 1. But I'm actually in a phase 2 trial, which means it's past the first stage of healthy adult screening, where it was fully proven to be safe and there was no undesired outcomes. So the vaccine I have, I'm going to read a little bit of a spiel so that you can all understand it as best I can for you. Now, the Pfizer vaccine that's just been rolled out in the UK and the US is an mRNA vaccine. So it's a DNA code. The DNA code gets put into your cells, and then your cells make the proteins for the virus. The vaccine that I've just been given is the protein, okay? Protein makes the shapes. So, let me take this off. Okay, so instead of being a DNA, mRNA vaccine, it's a protein vaccine. So, this little bit on the outside of the virus, this little spike protein, on the very edge of the spike protein, okay, so on the very edge of this little guy, okay, it's called the receptor binding domain, RBD. Now, they take that little part off the top there, okay, that is a protein, then they mix it up in this little solution, and then they mix it with some stuff, aluminium, and they give you the jab, which is your vaccine. Now, my particular jab of the vaccine is the RBD, so the receptor binding domain on the end of the virus, and it's actually been mixed with a protein that is on the outside of hepatitis B. So like the CSL one was mixed with a HIV protein, mine is mixed with a hepatitis B vaccine, and that helps to stimulate my immune response. So it is being put together by this company called Axelogen, and Axelogen is a spin-off company of the Oxford Vaccine Company. So it's one of the Oxford vaccines, but it's not the Oxford vaccine that's already in stage 2 clinical trial. It's a little bit different. But there are 200 vaccines in clinical trials right now being tested all over the world, and this is just another one of those things. This particular one has not been sponsored by the Australian government yet, but it's been tested in healthy adults in Australia. So if it passes this phase 2, phase 3 trial phase, it's one of the ones that will become a candidate for the government to sponsor. Okay, so the hepatitis B little antigen, or the little protein, and the little coronavirus spike have been joined together with this thing called like a spy catcher technology. Just basically like glue that sticks them together, and that's already a vaccine that's on the market. They've just modified it to put in the little spike protein of the coronavirus. I know you're gonna have questions. It's in 2 different doses. So I've had 1 dose already 3 weeks ago. My side effects were a headache and a bad headache. So I had a bad headache probably for like 5 days, but that's very common in vaccine trials, and that's very common when you get a vaccine. I actually had a site swelling, so where they gave me the jab, I had a little bit of a swelling just for 1 day, but not much, and it wasn't sore the next day. You know how sometimes you get your flu vax or any vax and it's sore to do this? It was fine after a day. It was just the headache that hung around for a little bit longer, but a headache that went away with Panadol. But all of these things got reported in a little app that they gave me. And I also had to take my temperature with this special thermometer that they'd given me. And yeah, I had to record all these different metrics, probably about 30 or 40 different things about how I felt. And then they called me every couple of days to talk about how I was feeling and if the Panadol had made my headache go away, which it did. Now, this particular trial is where is it? A randomized, observer-blind, placebo-controlled phase 2 study to evaluate the safety, reactogenicity, and immunogenicity of the vaccine in healthy adults. Okay, and I don't know whether I'm in the placebo group or if I'm in the vaccine group. Now, the vaccine group obviously gets the little portion of the coronavirus plus the little hepatitis B mixed around with the aluminium around it. And in the placebo group, you get PBS and I think it's just PBS. Hang on, placebo control. Okay, the placebo is just it's just pH'd water, so something that's same consistency as your body, plus the aluminium as well. So you get a little bit of the aluminium, but you don't get any of the viral proteins. Now, I get my second dose on Friday coming, and at that particular sitting, I also get my blood taken, I get a urine sample for a full drug screen, I get another swab to make sure I don't have any coronavirus virus particles, and I think I'll have 11 visits over the whole time, and I think I was at visit number 3 by the time they gave me my vaccine. So I'll just see if there's any more questions. Okay. Hello, yeah, you're back. I'm back, Ellen. Great to see you again. Any comments on the discovery of the COVID in Europe in November 2019? I did hear that. I'll wait for some of the genetic studies to come out to see where we can track the origin of the virus too. So I'll keep you posted. Now, how many phases are there in a trial before it's 100% safe to use? 3 phases before it gets put out into the wider distribution. Now, Shaz says, does it frustrate you how the coronavirus is always referred to as COVID-19, the disease? In the beginning, it definitely frustrated me because, as you all know, you should know if you're in this channel, that COVID-19 is actually an acronym for Coronavirus Disease 2019, and that is caused by SARS-CoV-2, which is the name of the virus. Used to frustrate me, not so much. Susan Lewis says, have you had to quarantine during the trial process? No, there's no quarantine in the trial process because I was first of all screened to be negative against any coronavirus virus in my system. And when you get the vaccine, it's not actually the virus, it's just the portion of a virus to help you make antibodies. And I didn't need to be, I was part of the healthy trial. So if I came into contact, it would just be like a challenge. But no, I did not need to quarantine. Hey Linda, how are you? Linda, you haven't been joining me at the gym. I've joined a physical in-person gym now. So Linda, come on down. Karen says, how can they determine if there's any long-term effects from the vaccine? Or is it just assumed if short-term effects okay, then long-term will be too? Okay, they don't follow up. So my trial will be 180 days long. And I guess I'll be monitored up until that point and no longer. They don't do long-term studies on these types of things. Good question, and I'll see if I can find something for you about long-term impacts of viral studies. Who's got a wine? Have a sip. Tracy says, will they literally try and infect you with the virus to see if it's expected infectiveness? I think no, but hard to ask. Well, Tracy, no. That's called a challenge trial, and there is no challenge trials in humans when there is a vaccine rolled out. The closest you'll come to of a challenge trial where someone will be given the vaccine and protected would be to look at the effectiveness of the vaccine. They would give it to people who have a likelihood of being in contact with the virus, the bug, or whatever it is. And so frontline workers, when they get the vaccine, they are theoretically in a challenge trial, but not really, because they are just at the front line of the people who would most likely be infected. And there's no human challenge trials. They do that in animals for sure, but there's no human challenge trials. Okay, Shaz said, it frustrates me that top medical professionals use the wrong terminology, so the average person has no hope. Absolutely. Emma says, are you proud of the result Victoria were able to achieve with the harsh lockdowns? Absolutely. Can you believe we went from 700 and something cases a day down to 0, and we have freedoms and we don't need to wear masks? I think it's amazing. And as hard as it was for everyone, and the people who disagreed with the lockdown measures, we're all here because of it, and we all did a great job. So congratulations to you all, and congratulations to everyone who listened to this show and passed along the information, because now as we've had more freedoms and I've been out and about, down the street here at shops, out, you know, with my girls for dinner, and every time I'm out, someone comes up to me and says thank you. So I appreciate all of those people, and please keep coming up to say hi, because I want to meet you and I want to see your faces. Okay, Ellen says, now we may be close to a vaccine. Do you think that we will ever need to have a lockdown again? We are close to a vaccine in Australia, but the closest we are is having 5 million doses of that Pfizer BioNTech vaccine. We've purchased 5 million doses of that. So we are scheduled to have that in Australia from production in January, February, March. We don't quite know, but they say early 2021. So until we have early 2021 like the vaccine here, we are still literally every single day facing potential lockdown. So if a case gets out of quarantine, we are still facing a lockdown, and in Victoria more so than anywhere else, maybe South Australia, you'll see harsh lockdowns come back. Until we have a vaccine rolled out where we have herd immunity of over 70% of the population having the vaccine, we're still having a threat of being locked down. So we can't become too complacent. Now, Susan says, how do they know a vaccine works if those who take it don't come into contact with the virus? From the animal testing? Yes, from the animal testing. They can do some laboratory testing on your blood as well to look at, they know that if you have these particular shape of antibodies, okay, so coronavirus. Now, I've just mentioned that the RBD, receptor binding domain, is the portion of the coronavirus that they are directing the antibodies at. Antibody comes along, it's got two little limbs that come along like this. Okay, if we are making those particular antibodies, we know that we can neutralize and kill the coronavirus. So if a vaccine is only directed at this portion of the virus, and you have an antibody response that has the right shape, and we have tests to look for the right shape, then we know that you will have antibodies to protect yourself against coronavirus. And we know that without having to do the challenge trials because of the animal studies, yes, but because we can also look at the neutralizing ability. So we can take a blood sample and we can isolate out all the antibodies, and we can test it in an artificial environment and show that your antibodies can neutralize the coronavirus. So that's how we know. Well, we're back. We've done it. Full Farty Facts episode in 27 minutes. I'm glad to be back. Welcome back, everybody. We'll be having another show this week, likely, as we learn more about the UK mutation, or if there's anything new that I need to share. Please continue to write your questions underneath and I will get back to you, or some of my Farty Facts friends will as well. Dr. Dan, Dr. Audrey, and Dr. Dale will as well. So welcome back and thanks for tuning in. Bye.